Today we will start with soft tissue injury. The objective for this session that you will understand the type of soft tissue injury, and also you will be able to cure of wound and to how to stop bleeding. In soft tissue injury, the structure of the soft tissue, which is the structure of the skin, which it is of three layers: the epidermis, dermis, and the fatty tissue or the subcutaneous tissue. The wound, it is divided to two main types: the closed wound and open wound. The closed wound, it is an injury of the soft tissues in which the outer layer of the skin is still intact. So the outer layer still, there is no problem with it, and the soft tissue damage occur under the skin, beneath the skin. So you might, what to look in this case, what are the signs which is present? In this case, you will find that the patient is having tenderness on that area. The area will be swollen or bruises will be there. Hard area of the body, such as in the abdomen. The pulse of that client, it will be weak and rapid. The color of the client will be pale or cyanotic, vomiting or coughing out blood, excessive thirst. The color of the skin will be cool and moist, confusion sometimes, drowsiness and unconsciousness. Those are the signs of, especially if there is severe injury underneath the skin and there is internal bleeding. When to call 9999? We have to call 999 when the patient is complaining of severe pain and cannot move a body part without having the pain. When there is an injury, when the injured person is extremely cyanotic or extremely pale. When the abdomen is having tenderness or distension. When the client is having vomiting blood or coughing out blood. Patient shows signs of shock. So in those cases, we have to call for emergency help. What to do until they arrive? You have to keep the client at rest in a most comfortable position. It is according to the site of bleeding and to the site of the injury itself. We can apply ice directly to the injured site if it is available, ice pack. Elevate the body part which has the injury. Keep the client in a comfortable position and reassure the client. So we have to limit his activity. The second type of wound, it is the open wound. In this case, you can see the wound from outside. It is obvious in the skin. There are many types of open wound. The simplest one, which is the abrasion, which is a wound characterized that the skin has been scratched or rubbed, which mostly happened while falling during playing with children, with football player. So when the skin is rubbed or pushed against hard or rough surface. The second one, which is laceration, which is a cut usually from sharp object or blunt force treated over the skin. Sometimes it might be superficial or it might be deep. It depends on the extensity of the injury itself. The third type, which is the evolution, an evolution which is a wound in which a portion of a skin or segment or soft tissue is partially or completely turn away. So it is nearly cut it off, but still it is hanged in the body. Severe evolution, this is the type that in this case you see that the finger is mostly cut it away. Just it is hanged with the hand. Punctured wound. In punctured wound, which is a wound result when the skin is bruised with a pointed object like a nail, like a knife. In case of embedded object, if the object is still there, you will see how we will take care of it. So we should not remove it at all in this case, but we have to take care and to prevent further injury in this case. We will show you how to do that. The fourth type of open wound, which is amputation, which is a complete tear away of the body part, including bone like the finger or the foot. In this case, if we find a body part is completely torn out, we have to take it with us to the hospital when we are transferring the client to the hospital. But how we can keep it? We can keep it inside a plastic bag, wrap it well, then we can put an ice. There should be no contact between that amputated part and the ice. And transfer the client as early as possible. He has to be transferred by the ambulance. The puncture wound usually occur when a pointed objects such as nail enter the skin and puncture the wound, do not bleed much unless the blood vessels has been injured. We should not, as we said, we should not remove any embedded object or if in this case, in the picture. Specific care for open wound, but before taking care of the client, the first thing we have to check the scene first, then introduce yourself, take a permission from the client. If the client is unconscious, it is a permission for you to take care. So then call the emergency people for ambulance or 9999 if it is required. We have to put on gloves in order to avoid infection. This is a universal infection control. Whenever there is a contact with blood or any patient fluid, we have to wear the gloves. Apply direct pressure to control bleeding. Apply antibiotic ointment to the wound if it is there. Cover the wound with sterile dressing and continue monitoring and wrap it also with bandage. Control of bleeding. If bleeding is there, continue monitoring the person until the help arrived. Care for shock if shock is there, if the patient develops shock. Have the person to rest comfortably and provide reassurance for him. After completing, wash your hand immediately after giving care. Thank you.
Controlling of bleeding. In this session, we will discuss how we can deal with bleeding and how we can control it. Simply, the first step, after evaluation, we have to have a clean dressing and put it firmly and press it firmly over the site of the wound. Then elevate the limb. Then put a roller elastic bandage. After that, if bleeding is still there, we have to compress over the pressure point. So in dealing with bleeding, we have to control it immediately. We have to start with covering the wound with the dressing. Press firmly over it. Elevate the body part, which is the leg here. Let the patient lie down in order to have the leg over the side of the heart. Use a roller bandage around the dressing. Cover it probably and firmly. Use tape or tie the bandage toward the end. If blood is soaking and coming out, put another dressing over it and wrap it again with another elastic bandage firmly. Press over the wound and press on the pressure point, the arterial pressure point against the bone if the bleeding is still there. The pressure point in our body, in the upper limb, it is the brachial artery, and in the lower limb, it is the femoral artery. So elevation and compression over the pressure point, it will help in the controlling of bleeding and decreasing the amount of blood loss. So those are the brachial artery that we can press on them if the bleeding in the upper limb, and this is the femoral artery if bleeding in the lower limb. So we can press over it against the bone in order to help us to stop bleeding. If the wound is in the arm, it is the same thing that we can use it to prevent or to stop the bleeding. Put gauze or dressing, then bandage. If bleeding is still there, we have to put another dressing, additional dressing and bandage. Then compression over the brachial artery. So we have to squeeze the artery against the bone. Yeah. So we have to press firmly, elevate the hand in this case, and let the client lie down. Now, if an embedded object is there, we should not try to remove it out, because removing of it might lead to bleeding. Yeah. So we have to fix it with the dressing. We will put a dressing around it. And after having a bulk of dressing in order to prevent that object from moving, then apply a roller bandage around it to fix it. Then transfer the client to the hospital. So this is about bleeding.